Okay, welcome everybody to the webinar today. I'm so pleased to have you all with us. This is the second in at least a three-part series, we believe, of our ConnectMe Patient Network and why we believe that it really is the very best patient infotainment system for hospitals and other healthcare facilities. I'm Dan Hollingshead. I am the president and founder of Connected Patients, and I'm super happy to be here with you today to talk a little bit more about the ConnectMe Patient Network and really, how it is that it's able to provide so much value to the hospitals. We will, of course, answer questions if you have any at the end, so please do submit those via the Zoom screen, such as you're seeing here. And for today, what I wanted to get through with you in a half an hour or so, if we can be really efficient with our time, is the following. So a very brief reminder about Connected Patients and who we are, as well as our ConnectMe Patient Network. The three tenets that were really the core reasons why we even decided to go down the path of creating the ConnectMe Patient Network, which are, it needs to be very easy, and in pretty much any way you can define easy for a facility. It needs to be, of course, effective, and lastly, we knew that if we were really smart with how we did this, we could make it very affordable compared to really any other option that's out there. We then will move into a ConnectMe Patient Network live demonstration that you'll be able to see for yourselves as I go through it live, exactly how easy it is to use. And then lastly, we can share with you exactly how easy it is for your facility to try in-house the ConnectMe Patient Network for up to 90 days. So let's get started. Connected Patients is located in pretty much the center of the country, pretty much the center of the state of Kentucky, in Lexington. It was founded back in May of 2008. We are privately held and venture-backed, and have been in this space from that period of time. This is a sort of a pictorial history of the types of systems that we have historically installed, where there were unique screens in certain areas. Some of them might be touch screens, as you see in some of these pictures, mounted to arms that were available for the patients and visitors to use. And sometimes they were through TV screens, the content of which was driven by a computer. What you don't see in any of these pictures, of course, is the dedicated networks, the cabling that had to be run, the servers that are installed, of course, on the back end of the system. And, all of that basically amounts to a system that is pretty complex to set up and install, and quite expensive, requiring a lot of maintenance. So we made a move to the cloud and to leverage more effectively, much more effectively, existing networks and existing hardware that will make the ConnectMe Patient Network just a fraction of the cost, while retaining, and this is very important, while retaining 100% of the functionality of these other dedicated systems. And in fact, it's even better, it's better than that, because if you think about these dedicated screens, it really is only through those that people will have access to the system. And frankly, from our perspective, what a shame that is, because it's so powerful. It does such a good job improving patient care, the patient experience, that why not provide it to as many people as possible? And that's what the ConnectMe Patient Network is able to do. So here's a sort of a quick pictorial of how it used to be. You see the dotted line around the system as it exists. That's sort of this walled garden that I was just talking about, where it's dedicated screens on dedicated networks, and if you're not in front of one of those screens, frankly, you don't get access to the system. Whereas the new way of providing access is via your public Wi-Fi network, which you have already made an investment in. It's available everywhere. So if you think about it that way, pretty much anybody that can access your public Wi-Fi network can also access the ConnectMe Patient Network, making the number of users much, much higher, and therefore the ability of the system to provide you with actionable specific data is so much improved compared to some of those legacy systems, really any other system that's on the market today. And then before we move to the demo, just another shot about or demonstration of the system. So I won't go through all of these points, but basically, the tenet here for you to take away is that, very, very high percentage of your patients, of your visitors, will be walking into the hospital with a device that, is a computer in their pocket probably, and it has a lot of power, and it's theirs. They are used to using it, so it's familiar to them. And what if we could simply use that device to display the system on, instead of requiring the hospital to purchase these very expensive devices, as has historically been the case. So again, this is really the centerpiece of this new paradigm shift, this new way of thinking about what can a patient infotainment be, and what must it include, and what can we leverage that exists today in order to make it not only less expensive but also more effective. So with all of this said, let me take a pause here and move the screen share over to a different window, and then we will do a live demonstration. Okay, so once you're logged in via joining the hospital network, you'll be taken to a home screen that will look essentially like this, except obviously it will have your hospital logo here instead of this generic logo, and the users will be presented with a menu which will look much like this. Now, for the purposes of this demonstration and to keep things pretty tight on our time, we have a limited number of what I would describe here for you as categories, and then within each one of these categories are various options. Again, all of the categories, all of the shortcuts within the categories, these are all going to be highly curated and customized to your location. So, what you see here is a good representation of a portion of the functionality of the ConnectMe Patient Network, but certainly is not all. It's not going to be representative of all of the system's capabilities and functions. So just to go through these, and again, I'm doing this on my computer to make it easier for recording. However, the screen size here has been adapted to represent what one might see on a phone or a tablet, although in addition to those options, those mobile options, certainly the system can also be accessed via any laptop or computer. So should a patient bring their own laptop in, then definitely that would they would have the full feature set available to them as well. So what you see here is up at the top we have a menu button to at any time reveal or remove the menu from the screen. Makes it really easy for the users to access choices at any moment, that they decide they want to navigate somewhere else. Up here in the right-hand corner, we have the language selection. Currently within the system, 100% we have English and Spanish. However, we do have the capabilities due to the architecture of this system to have up to 180 different languages. So Connected Patients can help you to identify those patient groups that would be fairly prevalent at your facility, and make sure that the system is going to be accessible for them as well. So just to go through these kind of quickly, but to show you, hopefully give you some sense of what the functions here are. The help category largely is going to be broken out into these couple of options: the frequently asked questions and speak to an administrator. Now, what I'll show you in a moment is that the speak to administrator function also oftentimes is broken out to reside on its own, to make that additional mode of communication, that line of communication between your patients and visitors and administration, should you choose to make that available to them, just to make that even easier than it is here. So frequently asked questions, again, could be ones that you're used to getting and that we just create here access for the users to find those pieces of information at any moment that they might have the question, and not rely on needing to wait for somebody who can answer that question for them. So I won't go into those, but these would be backed up by the answers to those questions. And those would obviously differ based on location. And then speak to an administrator. What this system is again, it's another line of or mode of communication between your customers, your patients, their family members, visitors, and you. And so this one is really interesting because it is a two-way communication system. In other words, the user can send you a notification via the system that's going to land on the appropriate person's cell phone or within their email as either a text message or an email, and you're going to have the ability to respond back to that person no matter where they are in your facility. And so it's a really wonderful way to quickly address issues that might arise at any given moment. And so the system is architected, as you can see here, in a way where we can have some sort of canned, what we would determine, like canned issues that a facility might get questions about or have issues around. And these obviously will not only have the capability to change based on what your findings are and types of issues that you're seeing in your facility, but also based on various locations within your facility. So again, based on where I have indicated I am, which I said I'm in the lobby, I'm presented with these particular issues. And so, let's just say that I, have a question about an issue that's not listed. And so it says up here, I need to speak to an administrator about an issue not listed, and I'll click submit. And then I know that my request has been sent to the appropriate person within hospital administration. This is all, of course, 100% able to be administered within the administration portal of the system that, Connected Patients will help you with that process if you choose to do that, or or your users that you have granted that level of access to can also make sure that this administration list is up to date and parsed by function so that the appropriate person will get the appropriate notifications. So again, that's a two-way communication system that makes it really, really easy for you then to be able to more openly, more freely, more quickly and efficiently communicate with your patients and visitors. We have a movies on demand library that is kept up to date. This system allows for these movies are currently PG-13 or G, and they are appropriate for all ages. If your hospital has a specific threshold lower than PG-13, like PG or maybe even G movies, then the system can be edited in that way as well. So these movies are, this movie library is typically 30 movies and are updated each quarter, and up to a quarter of those movies can be changed out within each quarter to keep the total library fresh and up to date. Survey. So again, because I've indicated I'm in the lobby, the question that I'm asked here is going to be very generic, right? Because the hospital doesn't really know necessarily where I am and can't ask questions with that would require a level of granularity or specificity that I simply don't have at this moment. So am I satisfied with the cleanliness of the hospital? Yes. The respondent is thanked and they're able to close that survey. Now, the survey questions, as I've said, will vary based on, just like all other content, will vary based on my location. So for an example, if I were to go back here and say that I'm actually in a patient room, I'm asked now to give a secondary code that presumably the nurse will provide to the person. And this is really just an extra step of authentication, a secondary authentication that we can enable or disable. Obviously, it's enabled here to make sure that, this device is certainly known to be used by a person who is in a room. And so that allows us to have a higher degree of certainty, to have communications of any information that might be a little more specific, could contain some PHI, just to make sure that everything is certain and documented. So if I submit, then I think what you'll notice here is that the menu selections have changed. Now, as I said earlier, that speak to an administrator option is broken out. And we put a greater sensitivity around creating access for this because I have indicated that I'm within a patient room now. So that's, and just to show you, I am now in room 101. So to go back into the survey and show you the difference now with me being in a room versus me just being in the lobby or in a main area of the hospital. And this difference can apply to a multitude of different care areas. So not necessarily a patient room, maybe I'm in the emergency department, maybe I say I'm within the infusion center, anywhere where care might be given would be a place where you might want to have this version of this surveying available so that you can very, very accurately attribute the results of the surveying answers to specific clinicians. So I have the ability to select and choose which doctor it is that has been treating me. And likewise, in this scenario, I have the option of selecting a nurse. Now, again, all of this can be, turned on or off. It may be that you don't want the nurses to have been selected along with the doctors, or vice versa. And that's no problem to make that happen. So then my questions are different here now, because I've indicated that I'm in a care area. I've probably been there longer. And these are all just for demonstration purposes, of course, but I'm able to give my feedback and tie it to certain either criteria in terms of, when was I just rounded on, and then perhaps that's when this survey pops up, or a certain event within the application itself. For example, I'll show you in a moment, we would ask that the patients, provide us, generally the hospitals have us ask the patients to provide them with a couple of survey question answers prior to watching a movie. And the patients are very, very happy to do that. So I just submitted all those answers. The database, the live database that's happening in the background here has now been completely updated. Now, I gave all very, very good answers. I think that hospital administrators would be happy to get, but it was, they'll see those data, will be added to the current data set. And of course they'll be able to drill down, and I'll show that to you in a future webinar. But just to show you the free movies on demand, for example, if I'm wanting to watch a movie, I actually am not now asked a question, because I was just at the survey application and I completed the entire survey. Had I not done that, I would have been asked a couple of survey questions here, which again, it helps just to build out that survey and provide you with real actionable data. So I won't obviously bore you with watching the movie, but this movie, we could go full screen with it. And obviously if this were a phone, one would be turning their phone to the side to create more of a panoramic view versus this portrait view, so that the movie would take up the entire screen. We do bake in quite a bit of health education materials, and so patients or rather hospitals oftentimes have their own patient education materials. We build those into the system so that they are 100% available for the patients whenever they are able to view those. We are, of course, collecting all of the user data. So all of the, each time that the user is interacting with any part of the system, we know that, and we are recording those time date stamps, and we're able to report those back to you for incorporation into your EMR, EHR systems. The system also has the capability of allowing the patients to view the education later from their home. So as you can see here, by hitting the view later button, I'm able to opt into a system where I can enter my email, and then I will be given access to all the patient materials, patient education materials that I had access to within the hospital from any internet-enabled device for some period of time that the hospital determines. So it's really, really effective at helping to extend the learning window for those past patients of yours, and also to help, family members or those who may be assisting with the post-discharge care, so that they know exactly what appropriate care would be for them, as what for the loved one that they're helping to care for. We bake in some browse the web options to make that easy as well. Again, these websites are very general typically, but are also curated based on the needs and wants of the particular facility. We have an electronic whiteboard system. So imagine, I'm in room 101, as it says, and my nurse is Jan. I selected Jan earlier. And now Jan, or actually anyone with administrative privileges to do so, has the ability to send me a message, a one-way message to my whiteboard. And so what's really kind of cool about this is that they may just send it to me, or they may send it to everybody on my floor in my department, let's say, or you could send a whiteboard message to anybody who's on the system anywhere in the facility or across the campus. So again, this is more of a push notification, so this is not two-way communication channel like the speak to an administrator within the Help app, but really effective then at just helping to push out notifications. And again, I'll show you in a future webinar from, but the notifications can be, you can have canned notifications. They can be set up to be sent out on a particular schedule. So makes it really easy to stay in communication, keep your customers well informed as they are within your facility. Another thing actually that I wanted to mention here that is not shown here is very often we're building in a direct link to the patient portal for the EMR system that you might have. So it's a really effective way to drive traffic back to that portal, where obviously there's a lot of other really relevant and important information for your patients and visitors. We do have a little bit more here, different entertainment options. Also, what's not shown on here is we have a host of games that are also available within the system for your patients and visitors to play. We provide them direct access to all of their email, and then we also have the ability for them, this is just a PDF of a hospital menu, but we do also have the ability to have an interactive menu where patients and visitors are able to choose food items, and then those choices are sent directly to dietary, where they can be processed, and to help just operationally to make that a little more efficient. So again, this is meant to be a very, very brief overview of just a small fraction of the overall functionality of the system. Let me switch back now to my browser and show a more full list of the capabilities of the system that we haven't had time to go through here today, but that are available. And again, it's really up to each, not only individual facility, which ones of these capabilities they'll want, but which ones they would want within even certain areas of their facility. So let me switch back quickly over here to my browser, and I will show you that. Okay, so here we are back to the main deck, and so the last thing I have for you today is an offer that I'm hoping you'll take advantage of, and that is for you to be able to use and realize the benefits of the ConnectMe Patient Network in your own facility for up to 90 days, absolutely no obligation whatsoever. And we just feel so strongly that this is really the easiest and best way for you to try it out, understand how powerful the system is and how much it can truly, truly help you with your patient experience goals, and certainly improving those scores that are important really to all healthcare facilities. So it's very easy to sign up for the no obligation trial. You simply send an email to us at sales@connectedpatients.com, and in the subject line, please include this code CPN-90, and just including that code will ensure that we get this very quickly to the correct person who can reach out to you or whoever has contacted us from your facility to get the information that's going to be necessary. It's a very, very simple process, but get all of that in place as soon as we can and get you guys up and running again, so that you can see for yourselves exactly how simple and effective this system is at helping you to improve your patient experience scores. Be sure, of course, in the email that you send to include any of your contact information that we would need to be able to reach out to you. And again, we'll be back in touch very quickly to help get everything in line so that we can begin that trial for you. And then lastly, we actually don't have any time left because I unfortunately went over. We do have a few questions, but I'm going to get back to those who asked questions today via email. As I mentioned in the beginning of the webinar, if you do have any questions that you haven't asked today, always please feel free to send us an email, either to myself, my home business email is listed here, or to info@connectedpatients.com or to sales@connectedpatients.com. Really, any of those we will be sure on our end we get that question to the correct person who can answer them and get the information that you're requesting right back to you. So I just thank everybody so much for their time today. I hope you learned a lot from this webinar, and I look forward to hopefully hearing from you, some of you via email, and getting some of these free trials set up. So with that, I will let you get on with your busy days and wish you a very, very great rest of your week. Take care, everybody.